Hello, my name is Baltazar and this is my inpatient health assessment video. Before I go in the room, I will check the EMR for any recent lab values, any new orders. I would also check the door for any flags or any markers such as risk for fall. Knock, knock. I'm going to do my hand hygiene. My name is Honey. I'm going to be your nurse today. I'm just going to check your wristband. Can you tell me your full name and birthday?
Jorge Baltazar, 5/16/92.
Perfect. And what brought you in today?
Well, I was playing football earlier, and I think I pulled something here. My hamstring, my coach says. So it hurts a lot.
Oh, okay.
Can't keep my legs straight or anything.
Okay. And on a scale of 0 to 10, 0 no pain, 10 is excruciating pain.
It kind of varies depending if I'm walking or whatever, but like 7. 7 is probably.
Okay. So I am going to, from looking at you, I see his facial presentation. He is relaxed. Posture is body aligned. He is alert and oriented. And his speech is normal. And can you tell me what my name is again?
Honey Baltazar.
Okay. And where are you right now?
At the hospital.
Okay. And what time of the day it is?
Evening.
Okay, so that's right. So on the class out scale, he was able to, he was oriented to a person, place, and time times 3. So right now, I'm just going to check your vitals.
Okay.
So I will start with your temperature. And this is just going to go under your tongue. And we'll just keep it there until it beeps. It takes a while sometimes. His temperature is normal. Your temperature is 97.9. I also, at the same time, I took his respiration, and it was, I took it at 8 times 2, so that was 16, and it was normal. I'm gonna check your, and also his personal hygiene. He's clean, there's no odor. He's able to hear me. He didn't turn to one side. And so right now I'm just going to check your apical pulse for 1 minute. And I'm just going to go under your shirt if that's okay. And your pulse was 66, which is normal.
Perfect.
I'm just going to check the video here really quick. And right now I'm just going to check your blood pressure. Do you know what normally you run?
The average, I guess, close to 120 over 80.
Okay. So I'm just gonna palpate your blood pressure first, and then we'll go from there, just so I know. So we'll do this twice, just to. Felt it first. I'm just gonna have it turn this way. I was able to hear your heart rate, so sometimes it's just people have difficulty finding this pulse rate. So I was able to palpate it at 120, so I'm going to go at least 20 over, so I'll raise it to 140. So now we're going to do it again. So your blood pressure is 112 over 78.
Perfect.
Feeling okay?
Yeah.
Okay. And right now, I'm also going to check your pulse oximetry and see what your oxygen level is. So this will just go on your finger like that. I'm going to turn it on, and then it'll tell us what your oxygen level is. So your oxygen level is 97, which is perfect. That's normal. So I also already did the coma scale on you. And right now I'm just going to check your pupil size. See what it tells me. So fingers look straight. Pupil size is around 4 millimeter. And right now I'm just going to check for your muscle strength. So can you squeeze my hands? Squeeze
pretty hard.
Yep. Equal strength bilaterally. Now I just want you to do this. I'm going to check your resistance. Now don't let me push. Good. Don't let me pull. I'm going to same thing you do with your feet. Don't let me push. Don't let me pull. Good. And now just want you to raise one leg up. This one is the one that's injured. It hurts a little bit. Then you can put it down. What about this one? Perfect. So his right leg was hurting a little bit when he was asked to lift it up. Left side was normal without any difficulty. And we're also looking at his face. He doesn't have any facial drooping or any ptosis. And can you swallow for me? He was able to swallow without difficulty. And now I'm just going to listen to your respiration. I'm going to listen to your lungs. I'm going to listen to the front side first, the anterior. There's 6 areas I want to listen to. Then I'm going to listen to the back. There is the posterior and lateral. There is 6 to 8 areas. Okay. So I'm just going to, is it okay if you lift your shirt up? You don't have to take it off. You can just lift up a little bit. Perfect. No, everything was normal, and I'm just going to listen to your back.
Sit straight or hunched?
And just take a deep breath. Okay, take a deep breath. Take a deep breath. One more time. And one more. And last one. Everything sounds normal. There's no extra sounds. And then, do you have any cough?
No.
And if you ever cough, is there any mucus or discharge when you cough?
No.
No. Okay. And also would help if you can breathe deeply. That'll help expand your lungs, prevent from having, for example, pneumonia. And you can also use the incentive spirometer. It's a little device, and you can breathe in and help your lung. Yeah. And then now I'm just going to check your heart. I'm going to listen to sounds and see if there's any murmurs or if your heartbeat is regular. And when I was taking your apical pulse earlier, it sounded regular, your heartbeat. It wasn't irregular or anything. But I'm still going to listen to your heart rhythm. And I'm going to listen to 2 sounds, S1 and S2. S1, you hear it better at the apex, and then S2, you'll hear it better at the base. Lift your shirt up. So the first time I did, I used a diaphragm. Now I'm going to do it again. I'm going to use the bell because sometimes with the bell you can hear better sounds.
Okay.
And I was able to hear S2 at the base was loudest, and then S1 was at the apex. Everything sounds great. And right now I'm just going to check your fingers for capillary refill. This will show what your, so I'm going to push hard, let go, and it came back within less than 2 seconds. I'll check the other hands here. Now I'm going to also check your toes for capillary refills. Came back, it refilled within less than 2 seconds. And looking at his skin, there's no lesions, there's no, and his skin looks pink, intact. Skin feels warm to touch. And now I'm also going to palpate your radial pulse. I'm going to palpate both of them and see the strength. There are 2+ bilaterally, and I'm going to check your posterior tibial pulses. Equal bilaterally. I'm going to check your, do you mind if I take this off? This is the dorsus pectoralis. 2+ throughout. Perfect. And while I was doing that, I also checked for the pretibial, ankle, and pedal edema, and you don't have any that I can see. And if you would have an IV put on you, and if you have an IV fluid run, I would, at this time, I would check for the fluid and see what it said on. And also, if you would have an IV on, I also would check the site and see what the site looks like, if it's warm, if it's red, if it's infected, or if it's just intact and good to go. And I also checked your skin temperature. I checked for your skin integrity, and I'm just gonna pinch your skin for skin trigger. And it came back normal. It means you're not dehydrated. And I would also check, use a standardized scale to check for falls of risk for falls, and I would use the Braden scale for that. And if you were on a specialized bed, let's say an air bed, I would check for the setting for that bed too at this time. And now I would just ask you to lay on the bed. I'm just going to check your stomach.
Cool. Like this? Or
If you were able to lay flat, yes, perfect, just like that. And then at this time, I'm just going to lift your shirt up here just to look at your stomach. And you can put your hands in. And looking at the contour of his stomach, he has a flat stomach. And right now I'm just going to check for your abdominal sounds and see if they're present or not present.
I just ate.
Okay. I'm able to hear sounds in all four quarters. So that's normal. Right now, I'm just going to palpate your stomach for see if there's any firmness. If it hurts, please let me know. See if there's any tenderness, if there's anything abnormal going on. So right now, I'm just going to touch your stomach. Feel anything. Right now, I'm just going to go a little bit deeper and to palpate the deeper tissue and see if there's anything down there abnormal. You doing okay?
Mm-hmm.
That's fine. I wasn't able to feel anything abnormal. I'm also going to percuss your stomach and see if there's any abnormal sounds going on. All sounds the same. So that's good. And right now I'm just gonna, you can sit up if you like. We're done with this part. How is, are you able to eat normally? Are you nauseous?
No.
You don't have any difficulty with your normal meals every day? No? Okay. What about going to the bathroom number 2? How often do you go?
At least once or twice a day.
Okay. And what does it look like if you're able to see it? Is it round? Is it watery? Is it
Formed?
Okay. And what about going to bathroom number 1? Do you have difficulty with that, or okay, no pain going?
No.
And what does it look like? Is it clear? Is it orange?
No, clear most of the time. Yeah, I drink a lot of water.
Okay, good. And you said you're an athlete too when you first came in. And if he wasn't able to go to the bathroom number 1 regularly, then I would use a bladder scan just to check and see what's going on. And I also asked you about nausea. And also I would check if he has any drainage or tubes and see if there's anything abnormal there. And also if he was on a bed rest, I would check his skin. If there's any bed ulcers, I would also use a Bradding scale to check for fall risk and skin lesions. And I would also, if he was on a bed rest, I would implement turning at least every 2 hours. Do you have difficulty moving, going to the bathroom by yourself, or getting from the bed to the chair?
No.
And if he does have difficulty with that, then we would implement getting some assistance for that. And I would also check for using the SCDs and TED hose for any edema. And also, right now, we're done with this exam. At the end of the exam, I will have the patient lay back down in the bed. I would put only the head side rails up, and I also will give you your call light close to you. So if you need any help, you just push that call light and someone would come in quick for your assistance. Do you have any questions for me at this time?
Not that I can think of right now.
So after all the exams that I did from head to toe, what's your pain level again from 0 to 10? Did it get
like a 6? I haven't been moving, so
okay. Okay. So I will go and talk with the doctor, and he will come in and assist your leg.
Perfect. All right.
And I will do hand hygiene. Thank you.